afternoon. Thank you for joining us today for our MIPS Made Easy series. So just to welcome you, my name is Heather Miller, and I am a Senior MIPS Professional Service Consultant here at Nextech. And joining me today is Christy, and we'll be together at the end to do a Q&A. Hopefully, if there's any questions, we can be sure to get those along the way. If you want to go ahead and submit those questions through the GoToMeeting app, Christy can kind of manage through those as we're getting through the webinar and maybe to answer some of them along the way. And Megan is our third MIPS partner and is with clients this afternoon, but always available for anybody that needs assistance. So let's get into this. Just for a heads up, the information provided in this webinar does not and is not intended to constitute legal or other advice. Instead, this information, content, and materials are available for general information purposes only. Information in the webinar may not constitute the most up-to-date legal, financial, or other information. Webinar attendees should contact their attorney, financial, tax, or other advisors to obtain advice with respect to any particular matter. This webinar contains links to other third-party websites. Any such links are provided only for convenience, and Nextech does not recommend or endorse the contents of any third-party site. All right, on the agenda today, we're going to walk through what is quality reporting. We're going to discuss which reporting options to choose. We're going to talk about some reporting tips and tricks, and then we'll have a live Q&A with myself and Christy. Before we get started, just want to have a quick poll question, and I'm going to launch this poll. And if everybody can just fill in, how does your practice currently report quality for your MIPS reporting? Are we using Part B claims? Are we using a registry? Are you using a QRDA III? Or do you have no clue? This is just really interesting. And I put it there because I kind of had a hunch that we'd have some that have no clue. And it is our second highest percentage. So 72% using registry, both 3% on Part B and QRDA IIIs, and 21% here have no clue. So hopefully, before we're done today, you'll have a little bit of a better understanding and have some options in your quality reporting based off of the information provided. So let's close this out, and let's talk about what is quality reporting. So quality reporting is one of the 4 categories of the MIPS reporting. It is 30% of the total score. It consists of a 12-month reporting period, and you are scored on 6 quality measures that produce the highest point values based off of the performance and the benchmarks. From 200 approved quality measures, we have 4 different types of measures. We have outcome measures, we have high priority measures, process measures, and patient experience measures. There are also 3 submitting options. There are claims-based, registry, and electronic health records. There is also a web-based portal submission type for groups only. We're not going to get into too much details on that submission type today. We're going to look more on the 3 most common. And then we've got the component of 75% data completeness. This becomes important when you are submitting your 12 months of data and potentially your practice has gone through a change in your EMR or some type of disruption. The 75% data completeness is required for all of the measures that you are submitting, that you are giving 75% of the eligible instances. Some people get this confused that it's all of the measures together, but it is by measure. If there are 80 patients that are eligible for a measure in a reporting year, you need at least 75% of that data of those 80 patients actually submitted. So if it is not at 100%, you need to be able to substantiate what percentage of data you're giving them. So sometimes this becomes a little bit of confusion when you are asked how to produce that and where those patient lists would come from, but just something to keep in play that it is a requirement. So this is kind of the big four components of the quality reporting. But today we're really going to focus on those submitting options. So based on 2022 reporting, 40% are using a registry for their quality submission options. 30% claims-based, and 25% are using electronic health records. So we can kind of see that the registries really are the most commonly used. Claims-based is still out there, even trumping on the EMR component. So what is a registry? So there are 150 approved registries. When we say approved, meaning the registries have applied to CMS to be a certified registry with a specific list of measures that they are allowed to report on the behalf of a practice. So you have ones like MD Interactive and HealthMonix that are not specialty specific. So they're not a quality-based measure through an entity that has created their own measures. So if you get to the IRIS measure, or IRIS registry or DataDerm, they have specific measures that they have created that are only available within those registries. While MD Interactive and HealthMonix and Polaris are more registries that are available for all of the other quality payment program measures that you can submit through them. So of the 150 approved registries, it is your choice as a practice which one you prefer to work with. And we're going to talk a little bit more later on why you choose which one. But there's lots of options out there. Most of these, again, work under some type of a dashboard submission where they show you your numerator denominators, show your performance percentages, and then submit the data on behalf of the practice to CMS. So all of the submission is done. Now, most of them will also now, I think it's required at the registry level, to submit all of the categories should you choose to do that with them. So if you want them to submit your quality, that's the core product, but they also will submit the improvement activity and your promoting interoperability activity that you've manually entered into their dashboards or whatever whatever mode they have of collecting that data. So that's what a registry is. And all of them are monitored by CMS, have to go through approval processes and stay up on all of those requirements. So what is claims-based? Claims-based is quality codes that are submitted directly on that 1500 billing form. 30 claims-based measures are still available in 2024. So if you looked back at registry, we have over 200 that potentially can be chosen with the registry submissions. Only 30 measures are still available to report via claims. And you can only be a small practice to be able to submit claims-based submissions. And we've got some benchmarks that are very difficult to getting max points. So it's pretty much being seen by CMS that they're pushing us away from claims-based submission and moving into the registry and the EMR submissions or anything more electronic-based submissions. But still available. As you saw in 22, 40% of providers are still using this submission method. Our third submission method is electronic health records. So this is a very standardized submission method where the EMR vendor goes through also certification of an electronic clinical quality measure. So in claims-based, we have 30 measures available to report. In ECQMs, there are 54 total measures that have those specifications that vendors can go through that cert process and have them available directly in the EMR. So this basically is a submission method that extracts this data directly from the EMR, and then it creates a QRDA III file that would then be manually submitted or uploaded directly to the QPP website. And that file can have zero manipulation. So it's very important that if you download that document from your EMR, you can then directly upload that document with zero manipulation for this to work. So those are our three main ways that we can submit data currently to CMS for the quality category. Just to reiterate, we've got registries, we've got claims-based submissions, and we've got electronic health record. And those are our 3 key options. So let's go to our second poll today. Does your current EHR have electronic health record measures? Either a yes, a no, or I have no idea. All right, so we're getting a little bit more leveled out here. We have about 90% of you, yes, you do have access to measures within your EHR, and 10% of you are really still not sure. So reiterating to us the importance of this information so that you can determine what options you have available to you and then set up that best strategy for your reporting. So let's go on to the next section. Which reporting options do I choose? So let's talk about the pros versus the cons. It really is going to come down to weighing those, and those are going to vary with every practice's specific situation. So what is a pro for one practice might be a con for another practice. The bigger and more important part of this is to go through this activity with your practice and determine the best submission method for you and your team. So let's start about registry pros. Part of the pro of using a registry is to ensure data accuracy. You've got a data management company that is specifically there to ensure that the data that is pulling in is pulled correctly before submitting that to CMS. It allows for some specialty-specific measures. You've got qualified data registries that are writing their own measures specific to specialty, getting approval, giving you a little bit more flexibility in those measure options. They give you performance benchmarks, so there's a way for you to compare yourself to your peers that are also reporting some of those measures. It allows you to identify trends. It does simplify the process a bit because it's pulling that data if you have an integration with your EMR, and helps you to see and get a better, easier picture. And then it puts it on a nice dashboard for submission to CMS. It also can aggregate data. So if you happen to be in a situation where you are in multiple EMRs due to maybe a change in your EMR in the middle of a year, they do have a way to aggregate the data from those 2 entities and have it be able to report to CMS. Because pulling data from multiple entities isn't the easiest process, and registries are really good at that. So this is kind of a quick list of some of the key pros in a registry. So let's talk about electronic health record measures. What are the pros there? So biggest thing, they're done in real time, right as you are documenting your chart. There's nothing more that you need to do. Document the chart, document your findings, and you've completed that numerator in a sense of quality measures. Decreasing some administrative burden because there's no need to then go and ensure that the data going over to the registry is correct. There's a lot of auditing that goes on there. So we've got some decrease in that administrative oversight. And it also is another one that improves data accuracy because it's coming directly from the chart note. It is embedded typically in the back end of the coding, so there's really no real chance that things are going to get entered incorrectly. No additional cost. Most of the time it's right in the workflow of your current product. You can run those reports. You can get the data when you want it. You're not really dealing with any of those additional costs that typically do come with a registry. Higher benchmarks. So not sure if anybody's aware, but when CMS produces a benchmark file at the beginning of each reporting period, there are different benchmarks based off the submission type. So we have benchmarking for claims-based submission, we have benchmarking for registry-based submission, and we have benchmarking for electronic health record. And the EHR submission method gets the best and highest benchmarks. So another pro here is you've got a little more flexibility there of getting max points when utilizing the EHR. The one that gets the lowest is going to be your claims-based. So let's talk about some pros in claims-based. Very cost-effective. There is no additional cost. You don't have to purchase an EMR. You don't have to pay for a registry. You just put the G code into your practice management system, push it over to that claim form, and you're done. Also, it's a familiar way. This is the old school way. It's how we started back in PQRS. We added G codes to the claim forms if you participated in PQRS when it was incentive-based, and then when it became required. But this is the way we just knew how to do it. Bringing it back to a little bit more of a simple method, if again you knew your G codes, got it into your workflows, it was pretty simple if it was produced. Real-time data, going out with your claims, going out with your billing, and it is really one that was easy for very small practices, particularly for financial reasons. You didn't have to invest into a new system. You could kind of maintain the way you were and still be able to submit and be responsible for your MIPS requirements. So those are kind of looking at those three cons for the three different submission methods. So let's look at some of, I think I said cons, I meant pros. Now let's talk about some of the cons. So for reporting, registries have a cost. Typically it's a cost per provider. For larger practices, it could be a very expensive connection to use that registry. We have measure mapping audits. So you do have to spend time and additional energy to make sure that the data that's coming over from your database to that registry is accurate. Because at the end of the day, you are responsible in that audit that you gave CMS the most accurate data and not truly the registry. The registry is going to ask for your permission to submit this data stating that you've reviewed it and that everything is accurate. So be very, very aware that that audit needs to be happening and not just trust that everything's perfectly going in there. Obviously, you have multiple parties involved. It's not just you and your reports and CMS. You're bringing in a third party that you can work with. Now, most registries have great product support. You'll be assigned hopefully a contact that can help you understand how their registry works, answer questions for you, and kind of be there along the way. EHRs, there is a cost for the software, and we have less measures. We only have 54 measures to choose from, so therefore, when a lot of people will ask, why can't we put this measure that I see at the registry in my product so that I can document it just like the rest of my measures? Well, if a measure does not have an ECQM, we cannot put it, or a vendor cannot put it into their software. I know EMR vendor out there would love if we could put everything right into the software, but we need to really push for CMS to write more ECQM specs to give some options specifically for specialty practices to add these EHR measures into different vendors. And then when we look into claims-based, we've got even more limited measures. There's 20. We've got some pretty awful benchmarks. I mean, it's either 100 is 10, and then anything else might be a 1 or 2 point measure. I mean, it is really, really tough to get max points in claims-based submission. It's either perfection or nothing. It's pretty cut and dry. And they're a little more harder to monitor. You can request reports from CMS so that you can see where you are currently from your claims-based submissions, but definitely doesn't just produce a numerator-denominator report either right within the system or on a nice dashboard from within a registry. So it makes it a little bit more difficult to monitor. So looking at all of those pros and cons, let's talk a little bit more about your primary goal for participating in MIPS. Is it to maximize reimbursement? And let me share this one for you real quick. Maybe. All right, is it to maximize? Is it to improve patient care? Is it for meeting regulatory requirements? Or do you have another reason that you are participating in the MIPS program? I see I launched it, but I don't see anybody answering it. I don't know if anybody, oh, you can't answer? Well, that's no fun. Maybe just pop it in the questions. I launched it, so it should be there. The results only. Oh, that's weird. It's already closed, so maybe something happened. Well, I've got one that's telling me regulatory requirements. We'll kind of go on. I would assume most people, oh, there's some maximizing reports. There's an all of above. So let's just go on all of above. And the reason I ask this question is because when it comes down to choosing your submission method, you really understand what's your primary goal for participating in MIPS. And then that will help guide you on what reporting is best for your practice, your strategies, your goals. And again, a little bit all over, but a lot about meeting regulatory requirements. So let's talk about some tips and tricks for registries. Pick a best registry. Does it have relatable measures? Does it align with your specialty? Can you achieve max points? So really looking into that before you invest the dollars, look and say, does this registry and will this registry give us what we're looking for? Ensure data accuracy, monthly data reviews, look at the gaps, make sure that you are able to see that, that the data is correct. Do you need to provide training on the mapping to these registry measures and give accountability to that team? So a lot of things to go on there, and just make sure when that data is getting to their dashboards, it is pulling and reflecting what is going on inside your report. And then leverage the feedback. And so you'll get feedback. You can get improvement based on that data that they're giving you. And it's really nice to see it in that dashboard so that you can improve over time. Looking at your EHR records, again, pick your best EMR. Which EMR has relevant measures? Which one has data integrity that you can trust? Which one has the certifications for the other measures within the other categories in MIPS? So a lot of that's just going to come down to what, every EMR could have a different list of measures, and have you asked them, do you host ECQMs? What are those ECQMs? And, am I going to be able to utilize those for my submission for my MIPS? So good questions to ask when you're looking for and picking an EMR. Understand the measures, because the big thing here is it's happening live within the chart note. So know the definition, know the data elements, and know those workflows. Every EHR could be documenting a measure that is the same very differently. Every vendor is going to go through a cert process for an approved workflow, and then that workflow is what's going to make sure that your patients get into the numerators. So very important that you understand those workflows and those measure specs. Train and educate. Define the ECQMs. Everybody in your team needs to know their role. It is, and MIPS is a team sport. So let's make sure, if it's the tech, if it's the provider that's responsible for the finding, make sure each of them know their role. Sometimes it might be the check-in person that's getting things set up. But set goals, make sure everybody knows their role, and that'll ensure success with you with using your EMR to track your quality measures. In claim submissions, biggest thing here is accurate coding. It's all about codes. Am I aware of the G codes? They change every year. Make sure they're updated. Make sure they're updated in your practice management, on your super bills. However you're getting that data there, make sure you know that coding and it's aligned with the measures that you're choosing. Also, document thoroughly. At the end of the day, if you get audited on those codes, they're going to go back to your chart notes, and they basically need to match. So even though you're just submitting them out on your claims form and it's not coming from your chart notes, they're still going to want to make sure that that data is there. And then utilize feedback reports. A lot of people don't realize if you're on claims-based, CMS will provide them, and that'll help you identify those areas of improvement, since you don't have an immediate way to run your own report and look at the registry information. So moving into tips and tricks, kind of the last thing I like everybody to know is the choice is yours. All of these submission options do the same task. They all submit data to CMS. What you need to be able to do is confirm the best option for max points on measures. In MIPS, we're on a game of points. So we want to make sure we are getting the best options to produce those max points. Coolest part, and what I think a lot don't understand, is you can use more than one option. CMS allows multiple submission options. So if you want to use your registry for 1 or 2, 3 measures, you want to use your EMR for the other 3 measures, completely okay. You just do a QRDA III submission, you do a submission with your registry, CMS scores you on the 6 that generate the most points. Also with claims-based, you can still be submitting a claims-based measure also in that mix. At the end of the day, you're going to get the 6 measures that gain those high point values. Last thing is just stay updated on these program changes each reporting year, specifically with quality measures. Benchmarks change every year. Measure specs change every year. Codes could change every year. So if you're not staying up on those changes and updating your strategy, whatever it is, and honestly, you could do 1 year all EMR, the next year you decide to do all registry, everything is evolving. So just be very clear that the choice is yours. Options are there, just know what they are, and then at the end of the day, which one produces the best results. So let's get to a quick Q&A. I think this is a quick 30-minute webinar. I'm right at 29 minutes, but let's open it up and just see if anybody has any feedback, questions. Would love to hear it. And Christy, if you want to chime in, if anything popped in.
Yeah, absolutely. Great webinar, Heather. I don't have any questions out there as of now, but if you do have anything, the best time to ask is now. We're available to answer those questions. Also, if you are on our software, we do have MIPS consulting here at Nextech, and so you can reach out about that if you have any questions.
I'm sure there's somebody out there that has to have one question for me. This is just a topic that gets a lot of, we find a lot of confusion about the options. So we wanted to be sure you really clearly understood your choices that are available, what each one really kind of means, and then weigh out those pros and cons. At the end of the day, completely up to the practice and what's best for them.
Absolutely. Use your dual submission. Take a little bit from the registry if you want, and take a little bit from the software to get those max points. And then just also remember, depending on which software you are on, does that software integrate with the registry? Do those measures pull over automatically? Or is it going to be a little bit of manual work for you to be able to get those numerators and denominators over to the registry if that's the way that you choose to go?